This is Curative Design, and I'm Arun Matthews. Thanks for tuning into what I consider to be the grand finale of the Semmelweis story. What I wanted to talk to you about today was something that I had intentionally left out from the story. Can you tell whose perspective or whose voice was drowned out by all this pontificating about innovation, microbiology, physiology, and public health? That's correct, the patient's voice. One of Semmelweis' main redeeming qualities was that as a clinician, he was initially made aware of his problem at the maternity clinics by observing and listening to the plight of his patients. After all, in the game of life and death, who has the highest stakes? The patient. It was the patients that had heard of the blight surrounding the first clinic, the supposedly superior clinic run by obstetricians and medical students. It was the patients that came, oftentimes on their knees, begging to be admitted to the second clinic, where they knew their chances of living would be higher, and they would be reminded of this with the nearly daily ringing of the funeral bell as priests came in to deliver the final sacrament in patients that had recently deceased. Taking things into their own hands, these women would occasionally insist on delivering on the streets outside of the hospital altogether, and amazingly had mortality rates due to puerperal fever on par with those of the second clinic, dramatically lower than the first. It was this single observation, coupled by, I'm sure, a sense of professional embarrassment over his clinic's poor performance, that triggered the study that changed the face of modern medicine, albeit in fits and starts. I suppose my question to you, if you are a member of the health sciences world, be it provider or any other vitally important member of the healthcare team, is this: do you know your own practice's mortality rates? If not, it would seem that we are all then members of the first clinic, happily trundling along, doing the very best we can, at times falling into a languid state of repetition. Are we listening to the whispered needs of our patients? Are we seeing how they perceive and respond to our care? Are we aware of even the most basic measures of quality? Mortality, surgical site infection, hand washing, venous thromboembolism prophylaxis rates? I realize that in modern healthcare, there can be so many metrics that this can be overwhelming. Still, perhaps if we were to take the time to select just the top 3 that were relevant to you based on your area of practice and really investigate them, that this might be a manageable thing. Decide if the data is even correct, and then set aside a simple plan to improve by implementing a simple intervention or two. Even if there is some doubt around the data, look for trends. Don't let that dissuade you from intervention. Follow, be aware of your own information. Similarly, if you are a patient, the Semmelweis story tells us that your voice is so very powerful in the equation of healthcare. Engage in your care. Be an active participant. Ask about every medication and intervention that you are agreeing to be responsible for. Give feedback to your providers and be sure to share not only the wins but also your disappointments. Learn about your condition and be a resource. It is the essence of what we know to be the best kind of relationship between the patient and the physician, a partnership. Semmelweis did the hard work for us in this regard. He set the mold for what I believe a conscientious healthcare provider truly is, a change agent in their organization and possibly even society itself. This has been Curative Design. My name is Arun Matthews, and thanks for listening.